get out here by 9:45. So if you want, you're certainly welcome to make it less than 4 minutes and 50 seconds.
That's a tough ask of a politician there, Mr. Chair. But any which way, thank you to all the witnesses for coming today. I really appreciate the stories that you are all willing to share. I'm going to start with Mrs. Carr here. Before this committee even considers expanding MAID to mental illness alone in 2027, can you give us a flavor of the kinds of calls that Inclusion Canada receives from people and families about the existing MAID framework and what these stories tell us about the risks of expanding it further?
Yes, thank you for the question. So we receive calls weekly, and we get them not just from people with an intellectual disability and families, but because we have been vocal on the issue, we get them from all different types, people with different types of disabilities. And they fall into two categories. People with disabilities who reach out to us as a last-ditch attempt to find someone to help them because they have tried so hard for so long to get the help that they need. And people with disabilities who have accessed our healthcare system for just regular, ordinary, everyday things and got offered MAID along the way. Everything, as I mentioned, from a bruised hip because of a fall out of a taxi cab to accessing treatment for pneumonia. One thing they have in common is that none of them have wanted to die. We have had people call us a person with a disability who was a victim of intimate partner violence and had no access to income to be able to get out of that situation, and had, because she was on disability income supports and was feeling like if she couldn't get out of that situation, it would be better to be dead or she may be killed. We've had a person with muscular dystrophy who was living with a parent. That parent died of cancer and was providing a significant amount of support. Once that support was gone, they could not get the support they needed to live in their own home and were going to be institutionalized. We've had people on waiting lists for 3 years for chronic pain management specialists, and the list goes on and on and on. We have a binder of examples.
Thank you for that. And the question before this committee again about, with MAID being the sole underlying mental illness, based on the data we already have, what does it tell us about who is receiving MAID now? Why are they receiving it, and why that should make Parliament cautious about expanding MAID for mental illness?
Well, the data that we have on track 2 MAID, and often we're quoting the track 1 data, the data we have on track 2 MAID tells us that the people accessing track 2 MAID are disproportionately women, Indigenous, living in poverty, low income, are isolated and feel they're a burden on their families.
Chair, how much time?
40 seconds.
All right, so we're being told this next expansion can be made safe, but if we expand MAID for mental illness as a sole underlying condition, what conditions would that actually include, and what would that mean for suicide prevention in Canada?
So the definition that will be used comes out of the DSM-5, which is the definition of mental disorder in the DSM-5. There are 290 some different labels that fall under that distinction, and that includes intellectual disability, autism, trauma, eating disorders, gender dysphoria, and the list goes on and on and on. So we're talking about a hugely wide expansion to a significant number of people.
Okay, thank you very much, Chair. I will leave my time at that.
Oh, thank you very much. Dr. Ramsey for 4 minutes and 50 seconds.
Thank you. Merci beaucoup à tous nos panélistes.
Thank you to all our panelists, but perhaps I have a question for Ms. Carr to begin with. Ms. Carr, you introduced the notion of social determinants, poverty, lack of housing, isolation. Nobody in this life doesn't have some kind of condition. We don't live in a vacuum. So we often have a condition that's associated with other factors, other determinants. I completely share your view that those determinants should be analyzed or certainly discussed with the person. But however, what bothers me, if we deny that person the right to have access to MAID because of determinants like that, we are doing reverse discrimination. Namely, I could say, well, you're poor, so you're not entitled to MAID. Could you comment on that? And my second point is social determinants. How are social determinants affecting mental illness more than physical illness? I would submit that it might be more the case for a physical condition than for a mental condition, but I'd like to hear your views on that.
Much for the question. So to your first point around the social determinants of health, we have to, yes, you're correct. That applies equally to everybody in the population. Much like Track 1 MAID applies equally. If you have a terminal illness, it doesn't matter what your socioeconomic conditions are or your disability supports or any kind of supports or anything you have in your life, you qualify for Track 1 MAID. Track 2 MAID is a completely different story. We have singled out one group of charter-protected individuals, persons with disabilities. That is the definition that is met under Track 2 MAID. If you have a disability and you are not dying. So there's a fundamental equality issue at play here because we only offer Track 2 MAID to one particular group of people. And the people that we are offering it to, persons with disabilities, tend to have multiple forms of intersecting discrimination, like poverty, like a lack of access to supports, et cetera, et cetera, et cetera. When someone in the general population, suffering is inherent in any, it's equal across the board. Anyone can suffer intolerably. It's part of the human condition. When someone else is suffering intolerably, we do what we can to alleviate that suffering or to provide the supports and services necessary. That's not the case when it comes to people under Track 2 MAID who are accessing those, are under those same conditions. And your second question on whether or not the social determinants of health apply less to people with mental illness than they apply to people with a physical disability, I believe.
Or at least no further.
Right. What I would say to that is if people with mental illness are in the situation, they are not dying. They're persons with a type of disability. They are not dying, and they often do not have access to the supports that they require as far as mental health goes. I look at the population I serve. I serve people with an intellectual disability, 40% of whom have a co-occurring mental health issue, mental illness, etc. That they can't even access, even if they could access specialist services, very often those specialists are not trained to deal with people who have intellectual disability or autism and a mental illness. So they're not getting the support and treatment that they require to live a good life. So I would say that it applies the social determinants, and if you layer on the situation that they're in, poverty, when you can't pay for mental health services, when you can't pay for counseling, when you can't pay for psychiatry that isn't provided through your healthcare system, then you are multiply disadvantaged. So I would actually say that the social determinants apply just as much, if not more, to people with mental illness than they do people with a physical disability.
Thank you very much. Mr. Thériault pour 5 minutes.
Mr. Thériault, 5 minutes. 4 minutes. I'd like to thank all the witnesses for their testimony here today. Ms. Carr, if I understand your presentation correctly and your reasoning, You're saying there's systemic discrimination. People with a handicap or disability are ill-treated. And there's a perverse effect in this, which means that a system that cannot properly treat people with a disability would lead them to a single solution, which is medical assistance in dying. Or you're saying that track 2, because if I understand correctly, you're against expansion of MAID for people whose death is not imminent. So all the cases in track 2, don't you think that it's discriminatory in a systemic way if, for example, the Supreme Court had said in a general way, any person who has a disability will never have access because they are part of that category of the disabled and they will never be able to access MAID?
Would say, thank you very much for the question, Mr. Theriault. What I would say to that is the Supreme Court didn't say that. As a matter of fact, the Supreme Court didn't even say that it would apply to people with mental illness. The Supreme Court ruled on the facts of the case before it and was very clear about that.
Excusez-moi.
No, I'm sorry. The Supreme Court did say that a general exclusion would be contrary to individual evaluation because you belong to a certain category of people, it cannot be said that that category permits exclusion from MAID. So it has to done on a case-by-case basis. If we say you will not have access to MAID because you are a person with a disability, you're engaging in systemic discrimination. Maybe you won't agree with me on that, but that's what I'm hearing you say. You're saying MAID should not be a solution. Well, indeed, it's not a solution. We have to be able to treat people properly, and that's an absolute right. But Ms. Gladu, when she went to the Superior Court, what she said was, I want to be able to have that option, that choice. She was disabled. She lived a full life, but she wanted that option in her back pocket and have access to MAID. If that had been forbidden from her, that would have been systemic discrimination.
I do not agree with you. And what I would say is the systemic discrimination, if that was going to be the argument, then we would offer MAID to anybody who was suffering and wasn't dying. But we don't do that. We offer MAID to people with terminal illness, equally across the board, who are dying. But Track 2 MAID is only for one particular group of people. It's people with disabilities who are not dying. So if we were going to say that this is, we are somehow creating systemic discrimination by why wouldn't we be offering MAID to everybody? We would be offering it to everybody who wanted it, who said they were suffering intolerably. But we don't. We don't do that. And I don't think anybody around this table would think that's a good idea. So why then is it okay to offer MAID to people with disabilities who are not dying? Because their lives are somehow less worth living than everyone else's?
Merci beaucoup, Mr. Theriault. Senator Delphine for 3 minutes.
Merci, Monsieur le Président.
Thank you, Mr. Chairman.
My question will be for Mrs. Carr. You said that your organization received calls on every day. How many of these people that were offered, you said MAID, how many were assessed? Of these people that you say they were offered, but how many were assessed?
So on the people who have been offered MAID, because to my point, I was talking about people who go to the healthcare system for other typical things anybody else would go for, and they have been asked, Have they considered MAID? Are they interested in MAID? Perhaps they should go down this route. And as it was mentioned on the panel.
So, sorry, because my 3 minutes are
Okay,
running
sorry.
fast. So I understand from your beginning of an answer is that they will call you, but you don't know what's happening after. You don't know if they went to the assessment. You don't know if they went to the assessment.
No,
if they were granted, they were assessed like, yes, you can have it.
Those calls, those particular calls that I was referring to are people who have been offered MAID, persons with disabilities not
discussions
dying.
with the doctors
In
or
discussions with a doctor when they were not asking for it and when they were not there
So and
for
they call
that
you to
reason.
know what to do.
And when they call us, it's because they are fundamentally traumatized and wounded by the experience.
Understand. I appreciate the comfort you provide. So you have 300 associations, local associations. How many members do you have across Canada, or how many people are within this organization?
So individual members, it's over 40,000.
And about these 40,000 members, how many are, they're all opposed to MAID, and they're all opposed to Mrs. Gladue, what she did, and what Monsieur Touchon did? They all think that they were the two, that these two people were wrong, and everybody else feels that MAID should not be accessible by Track 2?
What they feel is that, and these are the individuals we work with on a daily basis, and our local and provincial organizations work with on a daily basis. And what they feel is that the availability of Track 2 MAID and the further expansion of it embeds stereotypes and discriminatory about their lives and their lives not being worth living and not being worth saving.
So, sorry to interrupt again, but I understand from your answer that all your members are not opposed to Track 2.
No. What we're saying is, yes, our organization and its members are opposed to Track 2. That is what I am saying. And further expansion of Track 2, as is the United Nations.
Thank you.
Thank you, Senator. And sorry, it's 2 minutes and 50 seconds, Senator.
Isn't this 3 minutes? Oh, I see. Okay. I've already wasted a few seconds. Oh, my goodness. Okay. My potentially questions will be for Ms. Gabrielle Peters or Dr. Frazee, maybe one to each. So maybe I'll start with Ms. Peters. Some witnesses speak about the expansion of MAID for people suffering from mental illness as a sole underlying condition as a natural next step to respecting rights. So from the disability community's perspective, does this feel like equality? I know that Ms. Carr has talked about the concerns about expansion, but that is one of the, the positions that we have heard is that it's about equality and respecting rights of individuals. So that mental illness that expansion is important. What are your thoughts on that?
Well, in listening to this last conversation and in general with the committee, it's very clear that there's very fundamental lack of understanding of what disability is, first of all, but also it is not, you can't equate someone's personal opinion in any moment with disability analysis. Okay? Disability rights has evolved from a period of time where people were largely institutionalized and the focus was on independence and the right to live independently. Then we entered the universities, we entered the community, and the analysis has evolved. It's an actual area of scholarship and study. So somebody like Nicole Gladue just saying, oh, I want this. You're equating that with actual analysis of how, given the history, looking at our situation, looking at our lives, and understanding all of these things in context, making a judgment of how this will impact our community. These are not the same discussions that we're having. So I think that absolutely it is not adding to disability rights. And one of the things that needs to be understood is that disability justice, one of a McGill law professor has written very well and eloquently about the fact of this evolution from disability rights to disability justice. And one of the things he observes is that we kind of went in thinking that if we just, fight for inclusion and integration into the existing systems, that would lead somewhere. But that people consistently come back saying policymakers are not getting it, and they're still not getting that they're not getting it.
Thank you, Ms. Peters. We've run out of time. Senator Lafreda for 3 minutes.
Mr. Chair. So my question is for Ms. Carr. A central concern here that I'm hearing this evening in this debate is the protection of vulnerable individuals. And I take from your view that the current safeguards are not sufficient to identify and protect the individuals who may be experiencing the structural vulnerability or external pressures. Would you see any specific safeguards that can correct those issues that are missing, and maybe support, and what level of support do you have for additional requirements such as mandatory multidisciplinary assessment or enhanced oversight in these complex cases?
Thank you very much, Senator, for the question. The first thing I would say is that the current safeguards are flimsy at best and have gaping holes in them. But I would also go on to say, as many others have testified in front of this committee, that when you have a fundamental equality issue, there is no safeguard that's going to fix that. What we have here is a situation where we have singled out one group of people for death instead of support. And 100% of the people that have called and are calling our office are saying they do not want to die. And we have a fundamental disability rights equality problem, and there's no more Band-Aids that we're going to be able to put on that's going to change it. And I would also say that with the safeguards, and I'm using that in air quotes because they, as I mentioned, are flimsy at best, that we do have, there's no oversight to even make sure that they're followed. And we see you just have to look at the Death Review Committee in Ontario and just what they're finding to see that there's really no oversight on whatever safeguards might be in place to start with.
Thank you. Thank you, Mr. Chair.
Thank you. Senator Wallen for 2 minutes, 50 seconds.
Thank you very much. I am sorry to hear the stories that we hear from people on this committee. I happen to have experienced in my own life, and I know many of my colleagues have, they have known close friends or family that have chosen MAID willingly. It was not something forced upon them. It was not something that they chose because they had some kind of disability, either mental or physical, or because of social determinants. This is available under the law, and they have chosen it. So while I think we all agree on one issue, is that discrimination is not a good thing in any way, what I'm hearing from many of you here tonight is that your choices or your situations mean that you are willing to see those who want access to MAID discriminated against. Unless, and I'll start with Ms. Carr, are you in favor of medical assistance in dying in any situation at all?
So first of all, I think we've made our position, thank you very much for the question, Senator. I think we've made our position really clear that we are talking about Track 2 MAID, not Track 1 MAID.
No, but that's why I'm asking about a general, what is your general view of this? Because it influences this other side of people who are not being discriminated against, but who want to access something that is legally available under the law.
It is legally available under the law only to one particular group of people who are not at end of life, who are not dying. And so we are not offering this choice to people who are not dying equally across the board to anyone. We've singled out one group of people who we have decided, because of our fear of disability or because how we perceive that who don't have lives worth living. And part of the reason why people experience the difficulty they experience is because of the chronic
But
ableism
many
and lack of
people
supports.
who have lives worth living, but who are ill or through some physical condition, physical illness, it might be cancer, or perhaps they've had mental illness most of their life, but they have come to the conclusion that this is not a quality of life. They want dignity in the way that they live and end their life. Should they be allowed that?
Briefly, Ms. Carr.
So people who have terminal cancer, to your point, under track 1 are already, that they have that right to access that. We're talking about expanding this law to first of all, the people that already qualify under track 1 or track 2, and expanding it even further to a whole nother group of people who are even more vulnerable, based on the fact that mental illness is predicated on a lot of suicidal ideation. And what we are saying is no, that we talk about it this in the...
Thank you, Ms. Carr.
Thank you.
Ms. Jensen for 2 minutes and 50 seconds.
Miss Hewitt, I live about an hour outside of Vancouver, and every time I drive down East Hastings, I see hundreds of poor souls living in squalor, danger, and deep pain. Now, you said that UBC did a study of the population there and found that 75% are living with mental illness, that they want support, not death. So what are we doing if we expand MAID in that reality? Are we treating suffering, or are we giving up on the sufferer?
I think we're giving up on the sufferer. I think that we had previous people that talked about the social determinants of health. If we have not put in place everything that we can possibly do as a society to build people up to where they want to live, so that they want to move beyond surviving and they want to move to thriving, well, then we haven't done our job as a society, and offering them MAID is the easiest way out, because it doesn't cost us any money and we don't have to do anything extra. I find that absolutely appalling. If Victor was here now, he would tell you that his assessment for MAID was the easiest medical assessment he's been through in his life, and it should not be like that. Does that answer your question? I'm sorry. Yes. Thank you for the question. Yeah.
Yes, you said there was no real attempt to explore alternatives that might have helped Victor live. Now, if those safeguards are already failing in today's system, why should anyone believe that they're going to work in far more complex cases where mental illness alone is the reason for the MAID request?
Right. As I said, many of us with disabilities, we don't exist, in a single state of disability. And my husband had chronic depression, and in his 20s and 30s, it was particularly unstable. But ultimately, it got under control. So we didn't meet until after that. If MAID had been around then, I would never have met and married my husband. So, I think that the safeguards that are currently in place are insufficient, because I went through a process where I thought I understood what a track 1 MAID patient looked like and a track 2 MAID patient, and my husband's died, and I still don't know whether it was under track 1 or track 2.
Thank you.
And
thank you, Ms. Hewitt. And I have to apologize for Senator Wells. I forgot him. So you have your 2 minutes and 50 seconds.
Great. Thank you, Chair. My question's for Ms. Carr. Thank you for the concerns you've raised today about people feeling driven towards MAID because of poverty and inadequate supports. Would you agree that the core issue is not MAID itself, but the failure of social systems, and that the solution should be to strengthen those supports while still preserving MAID as an option for competent adults experiencing intolerable suffering?
No, and that is not what we are doing. We are offering MAID to people with disabilities who are not at end of life. And that is the only group that is being offered Track 2 MAID. And now we're going to expand that, or we're looking at expanding that to 297 more labels under the definition of mental disorder in the DSM-5.
So it sounds like, would restricting MAID then in these cases remove a legitimate choice from individuals who are not being driven by poverty, but are making a considered and autonomous decision?
So I guess my question, Senator, back to you would be, why then are we not offering, if that is the premise, we're taking this particular special right away from this particular group of people. If we were worried about that, we would be offering MAID to people not at end of life across the board. It wouldn't be designated to a particular group of people and then further expanded to people with MAID for mental illness. We would be saying anybody who suffers intolerably and is not at end of life has access to MAID and can go to their family doctor or an assessor or a medical practitioner and request it. And that is not what we are saying.
Well, with respect, that's not what we're studying right now. I can appreciate the concerns. Do I have time?
35 seconds.
Okay, if I could move to, I'll pass. I think I have the second round question. Yeah. Thank you. I'll cede my time.
Okay, thank you. Ms. Tessa Dirksen for 3 minutes.
Thanks very much, Mr. Chair, and thanks so much to our witnesses who are providing testimony tonight, particularly those who are bringing us the lived experiences. Those are really important. We appreciate you sharing that. I'm going to ask a question, what I hope is a practical question, because I think it's important that we get this on the record with respect to provincial healthcare system readiness. And perhaps I'll address to Dr. Frazee first. A decision to expand MAID to those with mental illness was delayed to give provinces and territories time to analyze their capacity to assess and administer MAID for mental illness safely and in accordance with the law. That's really the core scope of this sitting of our special committee. So I'd like you to comment on your understanding of the current state of readiness of the provinces and territories to do this work.
Thank you for the question. The best way for me to respond is from my direct experience and observations working on the curriculum for which MAID practitioners, by which MAID practitioners receive their instruction. And my work on that group, when you read my testimony and my article, is that the profession, the medical profession, has not risen to the gravity of the decisions that we have entrusted them with, and they are unable or unwilling to disentangle those structural forces. I believe you're referring to them as social determinants of health. They're unable to disentangle that kind of suffering in cases involving stable physical disability. I therefore conclude that there is no basis to be confident that they will do so when mental illness is the sole underlying condition. In other words, if they cannot or will not apply the very highest level of scrutiny to these assessments and the moral seriousness that these decisions require, they can't be entrusted with greater power, greater authority over the lives of people who are very vulnerable to harm.
Thank you, Ms. Dr. Frazee. Mr. Thériault pour 1 minute 50 secondes.
Mr. Thériault, 1 minute 50 seconds. 1 minute 50. Well, Mr. Chairman, I wanted to put a question to Ms. Frazee, Professor Frazee, in the expert report, there are concerns, and there are a number of precautionary principles in there. When it comes to systemic inequality, it says during the evaluation of a MAID request, independently of the diagnosis of the requester, a clinician must examine whether the circumstances of that person result from systemic inequality. And in recommendation 6, it says that we must ensure that all requesters have access to all the social support that could potentially reduce suffering. We're talking about Safeguard 241.2. The person has to be informed of means available to relieve suffering, especially when that's indicated, so that we can intervene on structural inequality. Those parameters are not sufficient for you if they were applied properly?
No, with respect, they are not. Thank you for the question. Perhaps I can best answer with reference to just one case among many that I speak of in my paper, and that is a case of a young man in his 20s who wanted MAID because he was desperately lonely and felt that he would never find a loving relationship and have what he considered a normal family. I would suggest to you that the roots of this problem, the roots of the suffering that MAID is being deployed to address, those roots are very deep. How on earth can we safeguard against heartbreak, which was what motivated this man to request MAID, and he did die by track to MAID, frankly, of a broken heart and desperate loneliness. We can't safeguard against that.
Thank you, Professor Frazee. Senator Wallen for 1 minute, 50 seconds.
Thank you. I guess I just feel that we should put on the record here tonight some balance. We are in the process of declaring an entire profession, doctors, MAID providers, mental health professionals, incapable of understanding matters of life and death, and that this entire group of people is inclined to break the law and risk their licenses from some desire to provide MAID to people who don't want it. And I guess I'll ask Dr. Frazee that question. Are there no other kinds of doctors in Canada?
Well, number one, they're not breaking the law. That's the problem. They're interpreting the law liberally. They have...
Well, certainly they would be breaking the law if they were providing MAID to those with mental illness as a sole underlying cause, which many of you seem to be suggesting.
I'm not sure. I'm not sure any of us did suggest that. What I'm suggesting is that they are not, they're in a position where much of the suffering that their patients are speaking of is not medical in nature. And yet, under the MAID regime, as long as there is a significant physical disability to which this suffering can at least in part be attributed, then the requirements for eligibility are met and it's a legal death. But that isn't surely what this Parliament or the court intended.
Thank you. And last of all, Senator Wells for 1 minute and 50 seconds.
Thank you. Dr. Frazee, the committee received a letter from the President of the Medical Regulatory Authority of Canada signed by the medical regulatory heads from across Canada, all saying that medical regulatory authorities in Canada are ready for the expansion of MAID for persons with a mental illness. So based on what you've shared with us today, what additional evidence should Parliament consider before expanding Track 2 MAID for persons with a mental illness, knowing that the regulatory bodies have clearly said they have a duty to be ready?
I would request that you pay close attention to the evidence and the arguments being advanced right now in the constitutional challenge to Track 2 MAID that I'm sure you're aware of as it works its way through the courts. You have heard and you will hear from many of the organizational plaintiffs representing people with disabilities across the country, and I hope our voices will be heard.
So would you say we should leave this decision up to the courts rather than Parliament?
No, I'm sorry. I didn't mean to imply that. I meant that you will find well-reasoned evidence ready for your review and for you to weigh and to give weight to inappropriate measure and not just what the provinces are saying.
Thank you very much.
Thank you very much. And with that, we conclude the second panel. I'd like to thank all the witnesses for coming today and their very important testimony. We certainly have heard from you. Thank you. We will suspend